Sorry, Pat. Are
Oh,
you?
yeah, I'm
There you
here.
go.
I'm here.
Great. Thank you. Shlomo Melman,
Here.
Carolyn Meltzer,
Present.
Chris Miaskowski,
Present.
Shauna Stark, Carol Watson, Keith Yamamoto.
Here.
Great. Thanks very much. And Mark, we have a quorum.
Great. Thanks, Scott. With that, I'd like to turn it over to Daisy for a quick introduction and for consideration of the Educate concept plan. And the discussion will today cover both the Educate and the Educate 3 programs. So with that, I'm going to turn that over to Daisy's capable hands.
Great, thanks, Mark. Hi, everyone. My name is Daisy, and I'm one of the science officers with the Discovery and Education team. So let me just share my deck. All right, so I will be sharing with you today on the Educate and Educ 3 concepts. All right. Now, first, just a brief reminder that the SAF Goal 6 recommendations is to bolster CIRM's, Goal 6 is to bolster CIRM's workforce development programs to address gaps and meet evolving demands in regenerative medicine. And to do that, we'll be providing high demand technical training via the Bridges and Compass program updates, as well as develop programming to support outreach education efforts for K-12 students, teachers, and community members via collaborations. So I'll first go over the Educate concept, and what you can expect from this presentation is a quick background, including the overview of our mission and Edu programs. I'll be focusing in on Bridges and Compass specifically and giving you a rationale that we have for Educate. The rest of the presentation will be on more details on the Educate concept, followed by a timeline of rolling out the program and a quick summary and request for motion. So as you all know, CIRM's mission is accelerating world-class science to deliver transformative regenerative medicine treatments in an equitable manner to a diverse California and world. And really key to this mission is education and workforce development and training. And it's really a foundation on this pyramid that represents CIRM's investment in training programs across California. That's preparing the next generation of scientists, technicians, clinicians, who will be the ones driving the regenerative medicine ecosystem. Now, on top of this foundation are infrastructure programs that will enhance discovery, as well as research and development through our DISC, PDEF, and CLIN2 pillars, where those innovative discoveries actually translate into new therapies and treatments for patients. Now, this pyramid is supported by the education and workforce development programs that are training professionals who are the ones designing the experiments, managing the data, and producing therapies and the care for patients. And this is where CIRM's Edu programs really play a key role in guiding trainees to apply and adapt these learned skills to tackle future challenges, to contribute valuable research and insights that drive scientific innovation, as well as contribute very valuable perspectives that are reflecting the breadth of the California communities that they come from. In many ways, they're also giving back to their communities with their knowledge. And in particular, our programs also emphasize patient engagement and community outreach skills. And all of that together really provide a holistic training that drive that home. So one quote that I really like from one of our recent blog posts on our blog, The STEM Seller, I think really speak to this message. And that's that education programs build the biotechnology workforce that's needed to generate new cures. Now, CIRM's current portfolio of training programs span a range of training levels for students, starting from high school students all the way to graduate, postdoctoral fellows, and clinical fellows. At the bottom here, we first have Spark, which is our program that provides a summer internship opportunity for high school students. We currently have 11 active programs throughout the state, and since 2012, we've trained over 950 students. Next, we have our Compass program, which is our newest program, active since 2023, and we've so far trained over 300 students. Compass, there's 54% of Compass students who are first-generation college students. And this is a program that is targeted at trainees who are pursuing a bachelor's degree And typically these are trainees who are earlier stage, who maybe are curious about biology, but not quite sure of all the different types of opportunities that are available in the stem cell field. So this program is really guiding those students to explore different types of opportunities and careers in the field. We also have our Bridges program, which is our longest running program since 2009. We've trained over 2,000 students, and 47% of Bridges students are first generation college students. We have 15 active programs right now, spread out in different Cal State universities and community colleges throughout California. And the Bridges program is offering a long 1-year internship, 6 to 12-month internship really, for students who are more committed to the stem cell and biology fields. And those are students that typically are ready to jumpstart their careers upon completion of the program. And this program is typically integrated into associate's degrees, bachelor's, and master's degrees program at institutions. And last but not least, we have our EDUC4 program, also known as Scholars. There are 18 active programs across California, and we've trained 1,300 students, over 1,300 students since 2007. And this program supports graduate students, postdoctoral fellows, and clinical fellows. Now, the goal of all of our programs really is to build a skilled workforce capable of meeting the evolving demands in regenerative medicine. So today I'll be focusing on the Bridges and Compass programs in particular. As I mentioned, both programs train undergraduate, and Bridges trains master's students as well. The current awards we have span California, and there are actually 6 institutions that have both Bridges and Compass programs. And I'll come back to that later. The majority of trainees that we see go through our Bridges and Compass programs remain in STEM fields. So a note here that these are specific alumni outcomes specific to the Bridges program. Since Compass is still quite new, we don't have a lot of alumni information just yet. But as Bridges has been running since 2009, we have quite a bit of alumni outcome data, and we see that 83% of students actually remain in STEM fields. About 37% of them go on to do academic research of some kind, 31% go into the biotech industry, and about 24% continue to pursue higher education. Now, with both Bridges and Compass, our trainees also help grow and participate in the workforce development network overall. And through these programs, we've seen over 90 internship host sites and labs support and guide our students, 49 of which are biotech industry hosts. And altogether, so far, we've had over 800 mentors helping mentor and guide these students through these programs. Now, trainees are also making an impact along the entire pipeline from discovery all the way to clinical. And they're actually innovating and expanding the field in many ways. With both Bridges and Compass, we've had a lot of great anecdotes that we've heard from mentors over the years. This one in particular is from Kathy Ivey, who is a VP at Tenaya, and actually herself is a CIRM Scholar alum, so that's really cool. But she shared with us that a trainee helped seed their histology core and get it off the ground. We've also heard from other PIs. This is from Karen Abudi, who is a PI at City of Hope, shared with us that trainees have impacted the design of their clinical protocol in progress for IND submission. Now, overall, with these programs, we've seen over 500 publications in peer-reviewed journals that were enabled through this training. And this is reported to us by program directors in their annual report to CIRM. Now, the impact of these programs are really great, and continuing them is essential. As many of you may know, the current Bridges program is expiring in the fall of 2026, and Compass will be expiring a year after that. And the grants that sustain sustaining these programs really is crucial to achieving CIRM's mission. And in this time of funding instability, especially, support is very critical. So we are proposing to relaunch these programs with some updates based on the experience we've had managing these programs. We want to preserve program continuity in order to take advantage of existing infrastructures that are already in place, to be able to respond to funding challenges as well, and take the opportunity to implement some improvements based on the feedback we've gotten over the past 15 years. Some key insights that we've gotten from active Bridges and Compass programs so far is that there are ever-evolving demands of the field, especially in the current funding climate. And so we'll be offering an expanded array of internship opportunities, as well as encouraging development of hybrid and multidisciplinary skill sets for students. I also mentioned briefly before that there are currently 6 institutions that have both a Bridges and Compass program. And so there are some opportunities here to help increase efficiencies for these existing programs and optimize that training experience. There's also an opportunity to integrate with CIRM's infrastructure and scientific programs as well. And finally, based on some feedback we've gotten from awardees over the years, there are some opportunities to not only maintain the current programs, but also leverage existing synergies. There will be areas that we can implement additional flexibilities and also ways that we can simplify administrative burdens for both the awardee institution as well as CIRM internal management of these programs. And so that brings me to the EDUCATE umbrella program that we are introducing to you today. So EDUCATE is an umbrella mechanism to support, update, and improve the Bridges and Compass programs. And there are 3 different paths that an institution, an applicant can take. So the Compass, Bridges, or dual path, which I will explain in detail in a couple more slides. The objective of EDUCATE is to prepare undergraduate through master's level students for careers in regenerative medicine by identifying and supporting untapped talent and developing well-trained, adaptable, and committed professionals for the regenerative medicine workforce. The approach that EDUCATE takes will be familiar to many, similar to Compass and Bridges right now. Programs will be integrated into an institution's specific degree or certificate program. There will be structured mentorship and professional guidance. So trainees will be participating in very specific coursework, very structured mentoring, and professional development guidance. And of course, keys to these programs is the hands-on experience in the form of paid internships, activities in patient and community engagement, as well as CIRM conference attendance. Now, the high-level goals here is to promote exploration and expand access to careers in regenerative medicine for trainees who are curious about biology and want to explore the opportunities in these fields. Also, to promote efficient transition to careers in regenerative medicine for trainees who are more committed to a certain field and want to dive right into to start their careers. Okay, so what we are keeping with EDUCATE, these are some required elements and activities that are in the current Bridges and Compass programs that are working great. Training activities, trainees will still be participating in patient healthcare engagement, community outreach and education, and we are now requiring science communication to the public as an additional workshop or course. Mentoring and professional development, as well as participation in a CIRM-related training conference. Some administrative activities that we are keeping are the innovative and strategic training recruitment plans, alumni tracking and engagement, mentor training and best practices, as well as required knowledge and resource sharing between institutions as well as to CIRM. Some of the elements that we are adding to EDUCATE. So first, as I mentioned, an expanded scope of types of internships. This is certainly not a comprehensive list of examples, but some examples here would be project management, regulatory or manufacturing science, process development, data science, and computational biology. We'll be instilling key skill sets and competencies, and some of these examples listed here include time management, public scientific communication, data sharing, bioethics, and research ethics as well. We'll be leveraging inter-program efficiency. So for institutions where this is applicable, some examples include having joint activities for early and late stage trainees and opportunities for collaboration with CIRM's infrastructure programs, such as the Alpha Clinics, community care centers of excellence, and shared resource labs. Finally, administrative efficiencies. So some examples here are that under this umbrella mechanism, there would be more unified guidance, faster program execution, and lower administrative burden for both the awardees as well as for CIRM's management of these programs. Okay, so the overview of what the EDUCATE structure looks like, it is meant to enable continued support for Bridges and Compass programs with an added opportunity to create a flexible and accelerated path depending on the institution, the applicant institution proposal. So on the left, some of the things that an applicant might consider is the trainee target. So this would be the education level and the training needs of the trainee population. And of course, the institution's available resources and assets. And all of that taken into consideration will help determine the path that one can take under the EDUCATE mechanism. So on the right, you'll see 3 paths: Compass, Bridges, and a dual path. I'll explain in the next slide what that looks like. Okay, so for Compass will still be supporting early stage untapped talent. So this really is targeted to students who are curious about biology, but don't quite know what the opportunities there are. These will be 2 to 3 month internships over multi-year appointments, and applicant institutions will be those with bachelor's programs. The Bridges path will continue to support late stage, more career-ready trainees. So these typically are trainees who know they want to be in the STEM and biology space and want to get some experience in order to jumpstart their careers upon graduation. So these typically are 6 to 12 month internships that are held external to the host institution. And applicant institutions are those without CIRM major facility or regenerative medicine research infrastructure. So these would be Cal State universities and community colleges. Now, the dual path program is an added opportunity that can potentially support, or that can support, not potentially, both Compass and Bridges type trainees, but there is a potential here for trainees to transition from a Compass to Bridges type program under one mechanism. So I mentioned before there are 6 institutions that currently support both Compass and Bridges programs. So some depending on the specifics of the applicant proposal, there could be an opportunity here to streamline any desire to have trainees start in a Compass type program and go on into a Bridges type program where they're more transitioning to a job ready position. Okay, so this is what the maximum award budgets look like based on chosen path. So on the left, we're looking at total award costs over 5 years of the grant. And in the columns are broken down by path. So Bridges path, Compass path, and dual path. And these numbers are based on a maximum of 10 trainees per year over 5 years. Now the direct costs for the Bridges path will be about 4.2 million. For Compass, just under 3 million. And for the dual path, about 6.4 million. With overhead, the total award amount for Bridges path comes out to about 4.6 million, Compass about 3.2 million, and dual path about 6.9 million. The per trainee investment per year, and this is looking at a maximum of 10 trainees per year, and keep in mind that depending on the applicant proposal, they may not hit that maximum of 10, but this is just based on the projection of a max of 10 trainees per year. For Bridges, it would be 91,000, Compass about 64,000, and the dual path, depending on the proposal, will fall somewhere between those 2 ranges. And all of this is based on our grant management team analysis of true categorical expenditure growth and cumulative CPI % increase since 2021. And there is a 20% increase here for the EDUCATE budget compared to the current Bridges and Compass awards. All right, so the team and institution eligibility for EDUCATE looks like this. First, for the Bridges path, Cal State universities and community colleges with an accredited certificate undergraduate or master's programs in a biology relevant discipline. For the Compass Path, any California academic institution with an accredited bachelor's degree program. We are requiring that the program director must commit at least 5% expert, and the required expertise is in outreach and recruitment, as well as mentorship. For dual path programs, we will be requiring a co-director who must also commit at least 5% effort. And this really is to ensure that dual path programs are able to smoothly retain both elements of trainee types and trainee type activities. Each institution or applicant may only apply for one EDUC8 award per cycle. And what I mean by that is we are proposing to run EDUC8 in 2 cycles, one in 2026, which will cover the outgoing Bridges programs, and again in 2027, which will cover the outgoing Compass programs. And 2 cycles really will capture updates and improvements for these existing Bridges and Compass programs, but also provide a longer runway for any new applicant programs to come in. Finally, there's also a possibility, having 2 cycles will give the possibility of resubmission for programs that need improvement. And in breaking down or looking closer at 1 cycle timeline, pending board approval in December, applications will be available early March, due in early April. The applications will go to the GWG for review, and award contracting will take place in the fall of 2026 for cycle 1. All right. So in summary, the EDUC8 umbrella program will offer 3 different types of paths: Compass type, Bridges, or dual path training program. It will be annual for 2 cycles in 2026 and 27. The duration of the award is 5 years, and applicants are California undergraduate and master's institutions. The leadership and expertise required is the program director and mentorship and outreach facilitators. And for dual path programs, a requirement for a co-director as well. The max award cost for Bridges Path is up to $4.6 million, for Compass up to $3.2 million, and for a dual path up to $6.9 million. The number of awards per year will be 15 to 18 awards per cycle, and we're anticipating 1,500 to 2,500 trainees to go through these programs. The max projection that we're seeing is $99 million per cycle. All right, so that brings me to this. We are requesting that the Science Subcommittee recommend approval of the proposed EDUC8 training program to the ICOC with an allocation of $198 million to support up to 36 awards over 2 funding cycles. This will be max $99 million per cycle, and if there are unspent funds from cycle 1 to roll over to cycle 2. We're expecting 1,500 to 2,500 trainees to go through these programs, and about $3.2 million to $6.9 million per individual award. And that is what I have for EDUC8, and I'm happy to take any comments or questions before I jump into EDUC3.
So with that, I think we should ask for if there's a proposal to get this approved. So for nomination and seconding. So are there anybody so moved? Okay. So with that, let's open up for discussion. Amongst
Excuse me, Mark, and
the committee and the team. Yeah,
Mark,
go ahead.
I don't believe I've heard a second yet.
I second.
And who is the maker?
Maria.
Thank you, Mark.
Thank you. So with that, let's open up for questions and discussion. And I can't see necessarily all the names that might have their hands raised. So if someone can, Claudette, if you could tell me if somebody's got their hand raised, that'd be great.
We don't see any hands at the moment.
No questions from the Science Committee? Okay. With that, questions from the public or comments?
And then for all members of the public, you will each have 3 minutes to speak. We do keep time, and we will mute you as soon as the 3 minutes is up. So the clock starts now.
So this is Parijal Bhatnagar. I have a question or comment regarding the Educate program in the eligible institutes. It was mentioned that the eligible institutes are probably the Institute of Higher Education for the Bridge and Compass. And at some point, it was also mentioned that Bridge is also there are certain aspects that may not be required for Bridge. For example, if it is to bridge the students who might be gaining the expertise and bridging them for a job in industry or something like that. So is there a reason why an institute of higher education is required? Only the eligible institutes are the Institute of Higher Education and not necessarily another place, like maybe another nonprofit or another industry that do not provide an education, but provide an opportunity to the students to get the training.
Okay, Daisy, do you want to take that question?
Yeah, so the eligibility is for California-based institutions or nonprofit institutions. Sorry, let me just pause my screen. 1 second. Sorry about that. Sorry, I think I'm having some technical issues over here. I don't know, Kelly, do you want to quickly answer this question while I'm figuring out my
Sure, I can
screen?
step in. Sure.
Thanks.
So the Bridges program is targeted at Cal State universities and community colleges, which can include junior colleges. But what's required is that there is a certificate program or some kind of a degree program, for example, a bachelor's, associate, or master's, that the Bridges training can be integrated within. So that means there's already a biology certificate or degree program, and then the Bridges program provides funding to support the regenerative medicine components, and it supports the patient engagement activities. But most importantly, it supports a paid internship, which in the Bridges program has to be external to the institution because Cal State universities and community colleges don't have highly funded federal research infrastructure or CIRM funded research infrastructure to support the most cutting edge gene therapy and stem cell treatments and biology. So the Bridges program provides a bridge or opportunity to connect those students in these other places to these world-class labs, which are at the major research institutions around the state and including some of those with medical schools. So that is why Bridges programs are targeted to those institutions. Compass programs are targeted to any institution that has an accredited bachelor's degree program. And that's because what that program is really trying to target students who have an aptitude and an interest in science, but may not have had the resources in order to know of all the possible careers that would be available to them and may not have had exposure to an environment that can provide those skill sets. And so that is why we require a bachelor's program at those institutions. But Compass programs also have to be able to provide kind of the world-class research training opportunity for internships as well, which are found in those major universities that offer PhD programs and have medical schools. So they don't necessarily have to go somewhere else to do their internship, which is what you do have to do with a Bridges grant. Did that answer your question?
Maybe I can ask a more direct question on the eligibility. It does answer the question, but it doesn't clarify the intention. What was the reasoning behind creation of these programs? So just like the more direct question is that I have started a nonprofit research organization, and I have been previously funded by NIH and DARPA for last 10 years. And I have published in world-class journals. And since the nonprofit is new, I don't have the funds to, or, I'm not affiliated with an education institute, but under my mentorship, any student would get a world-class opportunity to get training in regenerative medicine, gene therapy, cell therapy. So I don't, is there any reason that why a nonprofit that is not affiliated with an educational institute that doesn't have a degree program is ineligible to provide such training opportunities to the students? If something like this is made available to a nonprofit like mine, it will be a great opportunity for the students, as well as it will be a great opportunity for our nonprofit to do cutting edge research with new manpower.
Nonprofit research institutions can host trainees from these programs. You would need to partner with one of them.
Okay, so partnering with education.
Do I need to move on, or should I finish answering?
You should finish the thought while
Okay.
you're there. So
The applicant institution, the one who holds the grant, has to be an accredited educational institution, but the interns, for example, Bridges interns, they go and work in labs at other places. And if you have an appropriate environment, you can connect with an existing Bridges program or a future Bridges program. And if you have the appropriate level of mentorship that can be provided and appropriate resources and stability, then you could discuss with those directors the option of training students there in your facility.
great. Let's go on to the next person. Thank you, Kelly, for that cogent answer. Claudia, is there another comment?
No, there are no additional hands raised.
Okay, with that, why don't we proceed to a vote?
Great, thanks very much. Maria Bonneville,
Yes.
Monica Carson,
Yes.
Mark Fisher Colpre,
Yes.
Elena Flowers,
Yes.
Judy Gasson,
Yes.
Vito Imbasciani,
Yes.
Pat Levitt,
Yes.
Shlomo Melmed, sorry, Shlomo. I'll come back. Carolyn Meltzer,
Yes.
Chris Miaskowski,
Yes.
Carol Watson,
Yes.
and Keith Yamamoto.
Yes.
Great. I understand Shlomo has dropped from the call for now. So the motion carries. Thank you, Mark.
Thank you, Scott. And with that, let's move on to the next agenda item, which is the consideration of the EDU3 Spark program. And Daisy, if you could lead the discussion on that, that would be great.
Sounds good. Let's jump over to Spark. And I'm still screen sharing, right? I'm having slight technical issues, but hopefully this is going through for everyone.
We can see your screen.
Excellent. All right, so the EDU3 Spark concept presentation, let's jump right into it. So similarly, what you can expect is the brief background of the Spark program, details about the EDU3 concept, ending with similar timeline and award summary and request for motion. So once again, the SAF Goal 6 recommendation, one of the recommendations is to develop programming in order to support outreach education efforts for K-12 students, teachers, and community members via collaborations. And to this end, we are proposing to relaunch the EDU3 or Spark program. Now, the Spark program is a program for high school students that integrates within existing summer high school programs at California institutions across the state. And it provides paid summer internships, typically 6 to 10 weeks in length, in the stem cell and gene therapy research labs at these institutions. Students also participate in prep courses and workshops that are relevant to their internships. They also are a part of activities in patient engagement and community outreach, and participate in an annual Spark conference. And these pictures are actually from our Spark trainee conference this year in San Diego. So as I mentioned, Spark trains high school students, and the current awards, we have 11 active programs across California listed here. And Spark students really are quite amazing in the sense that they're high school students, but they really get a lot out of these internships. And this is just an example of one of many stories that we hear. This is Sorania, and she did an internship at Sanford Burnham. And originally, she was motivated by family health challenges. She had entered the program with uncertainty, but now she's actually pursuing immunology and neuroscience. The high-level impact that we've seen in Spark over the years, we've had over 950 students that have been trained through the Spark program. And of those tracked, 93% of them report pursuing STEM paths after completion of the program. The objectives of EDUC 3 or Spark is to inspire, educate, and motivate high school students to become involved in CIRM's mission, and also to provide summer training opportunities and broaden participation in the stem cell, gene therapy, and related research space to high school students, especially those who might not otherwise have opportunities for these types of internships due to social, geographic, or other constraints. Now, the scope and structure of Spark is each program will still be led by a qualified program director who will be managing and coordinating all activities supported by the program. We are keeping these components. So, of course, the main summer internship where trainees will be participating in hands-on regenerative medicine research in host labs at the applicant institution or partnering organization. They will also be participating in auxiliary educational activities. So these are additional content, or, or classes that support the research internship.
Sure.
Sorry about that. 1 second. All right. Oh my gosh, 1 second. All right, I'm good. Additionally, they will still be participating in patient and healthcare engagement activities, community outreach and education. We will still be requiring an alumni tracking plan, and trainees will also participate in a CIRM-related conference. And what we are adding, there will be an expanded scope of internship possibilities. So some examples are in the manufacturing space, quality, data science or bioinformatics, and other disciplines that are relevant. We will be encouraging and leveraging partnerships with CIRM infrastructure programs and requiring resource and knowledge sharing. The institution eligibility are California public universities or colleges or private nonprofit academic institutions accredited by the Western Association of Schools and Colleges. Other institutions with a documented track record of delivering lab-based research training to high school students.
Daisy, could you Kelly to continue? Could that be okay? Can you continue?
Yeah, sorry, I don't know why
I'm feeling bad for you. Kelly, can you continue?
Sure. So, yes. So as Daisy just mentioned, the eligible institutions, in addition to those, other California institutions that have a documented track record of successfully delivering laboratory-based research training to high school students would also be eligible and welcome to apply. We do ask that programs have an existing high school internship or have had one within the past 2 years at the time of application so that this program can be integrated within that. The program director should have relevant experience to leading a program of this nature. If an applicant chooses to work with a partnering organization that can host trainees, that partnering site must have appropriate personnel and facilities to accommodate high school students and work with around their needs. And similarly, with the Educate program, an applicant may submit a single EDUC 3 application. Next slide, please. And this is just how the awards are budgeted. So similarly to what we discussed with Educate, the award caps were adjusted relative to our current program based on our grants management team's analysis of categorical expenditures, growth, and cumulative CPI increase. So the trainee stipends would be $5,500. They're provided a travel allowance to the annual conference. So in other words, the direct cost per trainee is $6,500. There's a program admin allowance also calculated on a per trainee basis. With the overheads, this makes for a total award amount of $704,000. Next slide, please. And this would be the timeline. So the current Spark programs have sufficient funding to provide support for one more summer. So they will be running through the summer of 2026. However, in order for continuity and for new programs to begin in summer of 2027, the awards would need to be initiated at the end of 2026. So the proposed timeline here, following the concept approval that we would hope would happen in December, applications would become available in early March, and applications would be due in the spring or so, and the review would be happening in the summer, with the ARS meeting happening in October or fall. Next slide, please. So in summary, we are asking for support of an updated Edu3 Spark concept. It would recur one cycle, so not recur. It would be offered as a single cycle in 2026. It would support programs for 5 years. It's offered to California-based institutions. Each award is capped at $704,000 total. We anticipate making about 12 awards, which would factor into approximately 720 additional high school students that could be trained through this program. So the amount of funding that would be required to support 12 new programs would be $8.5 million. And for this last slide, CIRM respectfully requests the Science Subcommittee recommend approval of the proposed Spark training program to the ICOC with an allocation of $8.5 million, which would support up to 12 Spark awards, each with a 5-year duration. This would provide support for 720 trainees to have summer internships, and the award amount per institution would be $704,000. And that, I'm happy to take questions, or if Daisy is ready to step in.
Let's
Daisy.
start with
Yep.
request for motion and a second. Can I get a motion for approval?
So moved.
Okay, Keith has moved, and somebody stepped in for a second. I heard, but I'm not sure who it was.
Carolyn.
Oh, great. Thank you, Carolyn. Thanks, Carolyn. Okay, with that, let's open up for any questions by the committee or comments. I'm not seeing any, but
Keith
Claudette, if you
Yamamoto
can
has his
confirm
hand
that.
raised. Keith
Okay,
Yamamoto.
Keith, thank you. Keith?
Thanks for this, Kelly, and Daisy. I had a question about the administration costs. So the administration costs of $41.67, and indirect costs as well. So what's the distinction between administrative costs and indirect costs, and what is the how is that per administrative costs calculated? What do you get from that? Because the total indirect costs, or the total costs in addition to the direct costs, are quite substantial.
Right. So the program administrative costs are the costs that supports it provides salary support for some of the administrators who are running the awards. It's supporting the patient engagement and the community outreach activities that they're doing. So it's direct project costs as well. It's just not tied to an individual trainee. So the stipends, and these are up to amounts. Not all programs provide the maximum amount, but some do. And so the indirect costs are more traditional, what you think of as IDCs that go to the institution, and that's 10%.
Got it. Good. Thank you.
There are questions from the committee? Okay, with that, let's open it up to any comments or questions from the public.
There are no hands raised, Mark.
Okay, great. Scott, if we could proceed with a vote.
Sure. Maria Bonneville,
Yes.
Monica Carson,
Yes.
Mark Fisher Colbury,
Yes.
Elena Flowers,
Yes.
Judy Gasson,
Yes.
Vito Massiani,
Yes.
Pat Levitt,
Yes.
Shlomo Melmed, Carolyn Meltzer,
Yes.
Chris Miaskowski,
Yes.
Carol Watson,
Yes.
and Keith Yamamoto.
Yes.
Thank you very much, Mark. The motion carries.
Great.
Thank you.
With that, I'm going to turn the meeting over to Liz. And Liz, if you could introduce yourself and bring up the next agenda item.
Yeah, of course. Thank you so much, Mark. I could just get a confirmation that the slides are coming through.
Yes.
All right, fantastic. So good afternoon, everyone. My name is Liz Noblin. I'm a CIRM fellow for program development. And today I'm going to be sharing with you an update on how the CIRM team structures and presents funding recommendations for the application review subcommittee. So why is this coming today? First, acknowledging that many of the members here also do serve on the application review subcommittee. And that committee very soon on December 11th is going to be seeing the first round of applications that have come through the updated CLIN2 program and the newly launched preclinical development program. So today we wanted to present some information to help you anticipate what you will see at that December 11th meeting. And then finally, I'd just like to acknowledge that this update has been a CIRM-wide collaboration under the direction of Gil and Rosa, but with critical input from our program team and review team colleagues and also our board governance colleagues. So with that, in this brief presentation today, we'll cover three main topics. The first is, what are our goals and objectives for really refining best practices and the structure for delivering CIRM recommendations? Then we'll go over what are the circumstances and the parameters on which CIRM would base recommendations. And then finally, a look ahead to the resources and the format of how these will be presented to the application review subcommittee for your funding decisions. So to reiterate, what you're going to see today is really a refinement of existing and historical practices that CIRM has used in many instances to make funding recommendations, in addition to the recommendations that you see from Grants Working Group or other review working groups. So today, again, this is in anticipation of the first round of scientific applications that are going to be coming through. We have developed more standardized guidelines for forming those recommendations, as well as standardized templates for sharing that information with the ARS to aid in making well-informed funding decisions. So the framework today has two main aims. These are to standardize guidelines and outputs based on these historical best practices, and in a way that aligns with the new and updated program objectives that have been coming through in our strategic allocation framework aligned programs. So our goal is to use this framework for the upcoming CLIN2 and PDEV or preclinical development application review subcommittee meetings. And as we receive feedback and as we move into applications from other programs, we'll make adjustments as needed. So this framework starts with delineating the circumstances, and in this case, that means the GWG outcomes that would prompt CIRM to develop funding recommendations. So first, I'm going to go through the three outcomes that we consider here, and then in the next slide, I'll talk through what are the parameters or the data on which those recommendations might be based. So the first GWG outcome is an application that receives a minority report. Just as a reminder, a minority report is issued when 35% or more of the grants working group members score an application with a score of 85 or above, so in the funding range. So in that situation, CIRM will take a look at the report and at the application and make a recommendation to the ARS aligning with either the majority or the minority position of the grants working group. The second outcome that would prompt CIRM to examine recommendations are applications that receive a median GWG score of 80 or above. And so this 80 range really reflects where we think the GWG has indicated feasibility and potential merit, so that if there's a budget circumstance or compelling justification based on the recommendation parameters, which I'll show in a moment, CIRM may make a funding recommendation that could differ from that of the grants working group. And then the final outcome or circumstance would be taking a look at the program budget. So in a circumstance where the GWG recommends awards that either exceed the available funds, or if considering GWG recommendations, additional funds remain in an annual program budget, CIRM may make recommendations that match utilization of that budget. All right, and then the parameters or the data that CIRM will use in forming a recommendation are these three key points here. The first is portfolio balance. So we'll examine our existing R&D portfolio. So in this case, this would be preclinical and clinical awards, and then present data on whether the area addressed in the application under consideration might be relatively novel in our portfolio or is in an area where we already have a strong representation. In addition to looking at our own portfolio, we'll also consider the external landscape. So in this case, especially with a focus on treatments that are already available to patients or those that are in late-stage trials and might soon be available, we would examine whether there are any relevant external programs that may have an influence on the value proposition or the impact of the application under consideration. And then the third category, which we call other factors, is an instance where we might present relevant information that we are aware of, either concerning the applicant, investigator, or institution that might be relevant either to CIRM's mission, to program objectives, or to their ability to carry out the activities in an application as proposed. All right, and so finally, I'll just end with an overview of how this information would be presented to the ARS for ARS funding decisions. I'll go through the four key resources here with a focus on what will be new coming on that December 11th ARS meeting. And those new resources are highlighted in blue boxes here. So the first resource is the presentation that's given by members of our review team, which will include an overview of the program or funding opportunity, a reminder of the review process that was followed, and then information on the program budget, applications that received minority reports, and a summary of any applications where the GWG recommendation and the CIRM recommendation differ. In addition to that presentation, the ARS will also have a complete score spreadsheet. This is typically an Excel file that has complete GWG score information for all of the applications under consideration, as well as listing for each application what is the final GWG and CIRM recommendation. Especially critical for these funding decisions are the GWG summaries themselves. These are comments that are provided by our grants working group reviewers and patient advocates, and our review team crafts these into a summary that has application information, but in a de-identified format. and with the GWG comments grouped by review criterion. Something new that will be included in these summaries starting in December is a recap of the key strengths and weaknesses that the GWG felt an application held. And this is intended to help focus in on rationale for a GWG recommendation to fund or not fund an application. And then the final resource, which will be new starting in December, is what we're calling a recommendation memo. And this will be the document provided to the ARS that presents the analysis and rationale for CIRM recommendations when those recommendations differ from the grants working group. So recalling some of the parameters and the analysis that would lead to a recommendation, the memo would include relevant information from CIRM's portfolio, as well as the external landscape that provide a rationale for the CIRM team recommendation. So that concludes the update. I'd just like to thank my colleagues who have helped develop these practices and this framework. We look forward to presenting this information to the ARS in December, and I'm happy to take any questions or comments from the subcommittee.
Any questions of Liz?
Pat Levitt has his hand raised.
Yes, go ahead, Pat.
Hi, Liz. So several things. First is a general question. You know, the NIH, I think last year, the year before, modified a bit the review criteria that included three domains. One is importance of research, which sort of replaces significance. Expertise and resources, can the group pull it off? And then rigor and feasibility, like is the plan detailed enough to know that there's rigor and they can actually do it? But that of course speaks to, you know, preliminary data that they may include, as well as an analytical plan. So since I've never applied for a CIRM grant and don't review CIRM grants, CIRM applications, I'm just curious that whether the various components that are in terms of instructions that are provided about how to review a grant, whether it's been looked at and modified in some way to align better with NIH, or whether you feel that CIRM's criteria are actually better than the NIH criteria. And these criteria were changed, I think, it was announced, I think, in 2023 or something like that. So I'm just wondering that. And then I have a few follow-up questions specific.
Yeah. Of course, thanks for that question. So I think for that first question, that would probably be best suited for Gil to address from the purview of the review team. Gil, do you mind commenting?
Sure, no problem. No, thanks, Pat, for the question. So what we do is we actually tailor the review criteria for each of the opportunities that we have. So the review criteria, for example, for our clinical program are going to be quite a bit different from those for the discovery program. At a high level, they do include the basics of, you know, overall significance and impact, the rationale, their plan and design, feasibility, and then of course we include population impact as one of the key elements. So at a very high level, we try to keep it consistent, but we fine tune it for each of the programs because they're looking for different things. Innovation, for example, comes into play more specifically in the early discovery programs, where that might be less the case at the clinical stage, for example.
Okay, thanks. Three questions based on what you presented, Liz. External program influence on, you know, which speaks to, you know, setting priorities. Is that focused on what's happening in California, or if there's a clinical trial going on in New York, that would influence the decision about whether it's a higher or lower priority?
Yeah, thanks for the question, Pat. So for this specific process, what we would really be providing is sort of a count and an analysis of the potentially relevant external programs compared to the application under consideration. So we are considering things that are on a path to US approval, with the assumption that those would be the therapies that would also be available to Californians.
Okay. The utilization of the budget, I understand you're talking about two components. One is if the recommended funding is over what the allocated budget is, and then one is if it's under.
Mhm.
I guess you talked about matching utilization of that. I presume that would be if it's under, and there would be an opportunity to use residual funds there. But is there any change in terms of if it's over? Because if it's over, then there's a decision made not to fund grants that were recommended for funding because it's over the allocated annual budget for that category.
Yes, and I think there have been a couple of instances of this in CIRM's history where if a round is, I think we use the term oversubscribed, the CIRM would provide our recommendations of if the ARS wished to stay within the annual budget, this is how we might recommend accomplishing that. But the ultimate decision of budget utilization is with the ARS.
Okay, all right. And then the third thing is something that relevant information outside of application, like, something about, I suppose, the applicant or the institution in which the work was going to be. So how is that information validated? Like there's information and there's information, right? You know what I mean? There's information and then there's things you hear about that may or may not be validated as concerns. So I'm curious about how you're going to go, how the group is going to go about validating that kind of information that's outside of the application itself.
Yeah, I think it's a great call out that would have to be, a very well vetted piece of information. Rosa, I see. Go ahead if you want to jump in.
Yeah, thank you, Pat. That's a very relevant question. And the team, through the team leads, they coordinate validating any of this information directly with the applicants in between the grants working group recommendation and the ARS. And if it's not validated directly with sources that can confirm that, we would not make a recommendation.
Okay, that's all I have. Thanks.
Thank you, Rosa. Thank you, Pat.
Other questions or discussion points?
I asked everybody's questions, I think.
Okay, with that, I believe we've reached the end of the agenda. Is that correct, Scott?
That's right. There's just one more item regarding public comment for items that are not on the agenda.
Okay. Great, thank you. With that, if anybody in the public has comments or questions on an overall basis.
We have one. Oh, your clock starts now.
Hi,
Okay,
I'm Parijat Bhatnagar. I have a specific question or a comment regarding the program PEDV. As I mentioned previously, I started a nonprofit, but there is a certain clause in the eligibility criteria that is making us ineligible. My nonprofit is eligible for DARPA, for NIH, and that's where we are applying funding. And as we all know, it's hard to get funding now from federal sources, but California funds are one area where I was hoping that I could apply for the nonprofit. But one eligibility criteria in the nonprofit for PEDV and some other programs is that there need to be at least one W-2 employee, and we don't have that. And I wanted to ask if CIRM would reconsider if it is really required to have a W-2 employee. I am the CEO, acting CEO of nonprofit. We have 3 board members, including me, but none of us are really paid right now because we don't have funding. Our plan has been that we are writing proposals to NIH and DARPA, hopefully to CIRM as well, if the criteria is relaxed. If we get the funding, then we will hire people and conduct our research. We have already been allotted space in incubators and also we have collaborators in different universities where work will be conducted.
I think what would be most helpful, to acknowledge the comment and the question, and I think the most efficient use of time would be for our team to get with you offline, to follow up with your particular questions, because that way there could be a more fulsome discussion, and I'm sure you're going to have follow-up questions. So if you don't mind, I'd like to
absolutely, my feeling
have you talk to our team.
Thank you. Yeah, my feeling is that when this criteria was created, such a situation might not have been thought of where a nonprofit is there without any employees. But it is a legal entity in California registered. And so if this situation could be considered and eligibility criteria could be made more relaxed, that would really be a big help to us.
Well, thank you for the comment, and we acknowledge it and look forward to having our team discuss it with you on a more fulsome basis.
Thank you.
Other comments or questions from the public?
It doesn't appear so, Mark.
Okay, with that, we can adjourn the